I'm going to be talking about antisocial personality disorder and why I am diagnosing Dexter Morgan from the show Dexter with it. Dexter had a traumatic experience in his childhood, which was seeing his mother getting murdered, and then later he was found sitting in her blood by the cops, and that caused him to become a serial killer as an adult. And as an adult, he only kills people who he thinks deserve it, like other criminals or serial killers. Dexter would manipulate his victims by going undercover and forcing them to meet up, where he would later trap them, and then he would stab them in the heart, cut off their body parts, and put them into trash bags to throw them into the local bay where he lives. That was his signature move, his method of operation. He would always kill his victims this way. This is a big part of why Dexter struggled to find real love or have normal relationship with his colleagues. He normally puts on a fake persona while he works for the Miami Metro Police as a forensic blood spatter analyst, which is ironic since he's a serial killer. And on his free time, he would do the unthinkable crime of killing others, but he would only do so since he believed it was the right thing to do. I made this diagnosis since a big part of antisocial personality disorder is manipulation and irregular behavior, which is something Dexter does all the time with his victims because he kills them and manipulates them, and with his colleagues because he lies to them on a daily basis and he's being fake with them. Those with antisocial personality disorder also tend to break the law, and what Dexter is doing is a perfect representation of that. He always thinks about himself, and he doesn't rest when he kills until his victims get what they deserve. And it doesn't matter what others think about it or what others tell him to do, because he has drives and urges that cause him to do so, regardless of what others think about what he does. Regarding a biomedical treatment for this disorder, there is no exact treatment. There are, however, medicines and treatments that can be provided for symptoms of this said disorder, like anxiety or aggression, but it is important to be very cautious when prescribing these medications to patients with antisocial personality disorder, since they could potentially misuse it and in many harmful ways, which is a disadvantage to this treatment, but it is positive if it gets rid of the aggression and anxiety, which are a big part of this disorder. To treat antisocial personality disorder with psychotherapy, I will be using cognitive therapy, which could help restructure the way my character thinks and allow him to stop behaving in this terrible way. This will happen by helping the client reflect on his behavior and seeing how irrational it is. Fixing his thought pattern of killing every criminal he crosses could allow him to think more rationally and clearly understand that what he was doing previously was wrong. And this might not be the best choice if the client is not committed to treating their disorder, since no change can be made unless the client wants this to happen. But if the client is perfectly committed and ready to treat their illness, then progress can be made, change can happen, and his disorder could get better. These biomedical and psychotherapy techniques will be used to treat Dexter, and their effects will be dependent on his situation, willingness to get better, and if he wants to participate in these treatments or not.